Hi, I'm Dr. Sakina Davis.
Hi, I'm Lori Rhemann, physician assistant.
Hi, we're going to be talking today about COVID-19 and how to keep your immune system healthy. It's Wellness Wednesday, so Lori and I are just going to have some question and answers so we can hopefully give you some great tips and advice.
So one of the first things that I'm concerned about with COVID-19 is how do I protect myself and my family?
So that's a great question, Lori, and a great question that we get from a lot of our patients. So first and foremost, I think it's super important to realize that any virus, but especially COVID-19, is something that we need to work on ourselves and our own immune systems to protect them. So we've been recommending for the past 9 months during this pandemic to really get on some special supplements that we have right here for you. We're recommending vitamin C, vitamin D, and we do tailor that dose to what you specifically need, and zinc. So those are 3 of the most vital vitamins that we definitely recommend for everybody. So the great thing is now we have some combination supplements. So we have one that has vitamin D, it has vitamin C, it has zinc. We might need a little extra vitamin D, so again, we tailor it to your dose, but it also contains N-acetylcysteine and quercetin, both are which very important also to help your liver to detox and utilize these supplements correctly. And the quercetin helps the zinc to actually get into the cells and work in the bloodstream to help eradicate the virus. And we have another combination. So if you already have your C, D, and zinc, C and D, then we actually have one that has the N-acetylcysteine, quercetin, and zinc. So we've tried to come up with some multi-supplements so you don't have to take as many pills, because I know that some of you are probably getting some pill fatigue from all of these, but again, we've made it 9 months, and so hopefully we've kept you protected and kept you and your family healthy. And if you're not taking some of these with the resurgence of COVID right now, I would highly recommend that you look into getting onto some of these supplements, because most of us, unfortunately, are probably low in our vitamin D, probably low in our vitamin C. One thing to remember about zinc is that if you've been taking it for about 3 to 4 months, and it's around 25 to 50 milligrams that we typically recommend, you may need to stop it for a couple of weeks or introduce a copper supplement, because high doses of zinc for extended periods of time can deplete copper. So there's something to keep in mind. If you've been taking it for a long time, please come talk to us and we'll be happy to discuss if that's something that's important for you. All right, so yes, COVID unfortunately is rearing its ugly head again. We had a spike in the summer and then some reduced episodes over the last few weeks, but we're starting to see a spike here and around the world actually.
So I have a lot of guests that ask me, what do I do if I feel like I'm getting symptoms of COVID?
So the most important thing is to first isolate. So if you feel like you're getting symptoms of COVID-19, which include things like fever, chills, loss of taste or smell, if you're just generally feeling tired, and you just don't feel good, and you've been exposed or think you might have been exposed, the first thing you need to do is self-isolate. So you should be in your own bedroom and own bathroom. Obviously, if you're going to be going into any common areas, you need to be in a mask. So to prevent it, first of all, of course, you should be in a mask and socially distancing, washing your hands. But if you feel like you're coming down with it, then and you're not quite sure, first isolate. And really for testing, it's important to probably wait about 3 to 4 days to get tested. Because if you test the moment you feel bad, it may be likely that your test is going to come back as a false negative. So I would wait about 3 or 4 days and then get tested. The most accurate test at the moment still is the PCR test, which is the nasal swab. And there's lots of places around the Montgomery area or wherever you're watching, Harris County, that have availability to get your PCR testing done. Some that can come back usually within 24 to 48 hours now. So of course, if you test positive, then the next thing is you want to notify those people that may potentially have been exposed to you. And then we do offer televisit treatments that are important, that we can discuss your symptoms and offer you some potentially early treatment for COVID. So please contact us if you have some questions regarding that.
That sounds great. What would you suggest, like with my kids coming up for Halloween, for trick-or-treating, for family gatherings, like Thanksgiving and the holidays coming up?
So let me just say that this is the Dr. Davis suggestions, not CDC guidelines or Dr. Fauci, whom I respect a lot. But practically speaking, I think we have to look in the area that you're in. So if you're high risk And if you're in an area that there's a lot of COVID, I probably wouldn't do anything. If you're in an area where there's, milder amount of cases, my suggestion for these types of holidays is to first, if you really want to get together as a small family unit, I would suggest you quarantine for 2 weeks prior to the event. Try to just get your groceries delivered, or if you go to the grocery store, wear your mask, wash your hands, do all that. And then probably test 2 or 3 days prior so that we know that everyone getting together, which is hopefully a small group, will be fine. For Halloween, my personal recommendation, of course, is that this is an outdoor event. So kids can probably wear a mask. Hopefully we can have some type of small neighborhoods get together, groups of friends, who can have them go to each other's homes, maybe have some individual bags ready with their candy. So maybe that would be a little bit, more normal for them, so they feel like they have Halloween, but we're still being careful. So that's kind of that's again my personal suggestion. So
that's great. Thank you.
Yeah. So again, I think COVID-19 is something that we are going to have to live with for a long time. So the whole goal is protect your immune system, be safe, wear a mask, socially distance, and come let us know what we can do for you. Thank you.